Hello and welcome to this video. My name's Kris, I'm an Australian GP, and in today's quick video I am going to be covering a very common ailment that affects a lot of people over Christmas, and we'll talk about why in a second: gout. So gout is, as I've said, a very common condition. It's an inflammatory condition and it usually affects the joints, typically the smaller joints, so the toe, like the great toe or the thumb, but it can also affect any joint, including the knee, the elbows, the wrist, anywhere. Having gout means that someone will have a really painful, often red, swollen and hot to touch joint. This often occurs just so quickly. Often overnight, people will go to bed feeling fine and wake up in a world of agony. Mind you, not every gout attack is that bad, but I've heard it described as pretty gosh darn painful. So what is it exactly? Well, gout itself and the inflammation comes from an accumulation in the blood of something known as uric acid. Or at least this is the most common cause of gout, as there are a few things called pseudo-gout that come from something else like calcium, but we're going to talk about gout today, which is uric acid. And uric acid accumulates in the system, usually secondary to a diet high in purines. Well, what the heck's a purine? A purine is a type of protein, and it's found in a lot of foods that, again, are commonly consumed over the Christmas period, at least here in Australia. We've got seafood, particularly prawns and other shellfish, red meats, beer. Because uric acid is usually filtered out through the kidneys, people with kidney conditions or renal conditions are also more prone to gout. Other risk factors for having gout include having a higher body weight, being on certain medications, including something known as a diuretic, so something that filters fluid through the kidneys faster, having high cholesterol, and having high blood pressure. When we see gout as a GP, it's usually a spot diagnosis. I see it, I've spotted it, I've diagnosed it. However, a good history is always important, and looking at the joint and feeling it, because one of the biggest things we want to make sure we don't miss is that gout can mimic something called septic arthritis, or put differently, gout can look like septic arthritis and septic arthritis can look like gout. Gout, benign, it won't kill you. It may feel like it because it's apparently very painful, but it won't. Septic arthritis is when there is a bacterial infection in the joint causing a sepsis. That is a blood infection, blood poisoning, I've heard it called, and that's life-threatening, and that needs to be seen to ASAP. So we really do have to take a good history, review the joint, feel it, touch it, move it, get a good, sense of it to determine, is this possibly gout or is this possibly septic arthritis? Because the treatment is wildly different. The gold standard, or the thing that we should be doing for all gout, is actually taking some of the fluid out and looking at it under a microscope. So aspiration and microscopy to look for the presence of the uric acid crystals that would be in the fluid in the joint. Now, not all of us are comfortable as GPs taking fluid out of a joint, especially small joints like the thumb. Not all of us have access to a microscope. In fact, I don't know any GP that does, so it has to be sent away, which can delay treatment. And often with septic arthritis, yes, you can see a difference in the color of the fluid that comes out, but usually there are other signs and symptoms that you can use to elicit if that's the most likely diagnosis or not. We can also do blood tests to see if you've got a high serum or blood concentration of uric acid and urate to give us an idea if you're more prone to gout, and also help us with treatment. So we aim for certain levels if you've got X or Y, blah, blah, but we're not going to go through that now. And gout is treated really easily with medications. So the guidelines suggest that you can put a steroid into the joint, so an intra-articular steroid injection or into the joint steroid injection. You can use oral steroids for a couple of days to really reduce the inflammation. And I'll quickly just point out here, this is where the diagnosis of septic arthritis has to be excluded, because steroids will actually worsen a sepsis or an arthritis, infection, because bacteria love steroids. Anywho, so we've talked about intra-articular steroids, oral steroids. Really strong anti-inflammatories are also a treatment for gout and can be quite happily utilised. And there is also colchicine, which has kind of fallen out of favour as the #1 medication for gout. Then of course, it's not just about band-aiding, it's about getting to the root cause and figuring out why you are prone to gout. and then trying to reduce your uric acid levels if that is your main contributing factor, using medications like allopurinol to keep it under a certain level to reduce the amount of flares you have. Because this condition is chronic and it can wax and wane, flare. I've met people who have only had one flare in their life, and some that they'll have a beer and then they'll wake up with pain and haven't really figured out how to stop the beer part yet. But anyway, obviously lifestyle is really important too. So reducing alcohol consumption, making sure that you are within a healthy weight range, or at least are doing the best for your body in terms of movement, nutrition, and hydration, and reviewing your medications, seeing if there's anything that's contributing that could be swapped over to something else to not only support the condition it was prescribed for, but also reduce your chances of gout. And that's it. That's Gout 101. Nice, quick, and easy. If you have any questions, let me know. If you have any suggestions or conditions you want me to cover in a video, let me know. And until next time, stay safe, stay healthy, and I'll see you in a video very soon.